So Ohm's law is essentially this: the amount of current flowing through a resistive element is inversely proportional to the resistance. Okay, so what does that really mean? Simply this: electricity always follows the path of least resistance. Skin has a normal electrical resistance of between 10,000 and 100,000 ohms. This means it's a pretty effective electrical barrier. The dead, dry upper layers want to block the current from entering. The current actually has to pass this barrier twice, once on the way in and again on the way out. There are things we can do to lower this resistance barrier, and one of those ways is to moisten the skin with water. A wet cotton Q-tip can hold a great deal of conductive water. The moisture from the wet Q-tip can break down the skin resistance and allow the current to pass down from one electrode, across the target area, and then up to the other electrode. This is very efficient and sanitary. Just throw tips away after each client. Now let's contrast wet Q-tips with using solid metal probes or wands. The picture of the skin cell, on top of it, the blue part is representing the conductive gel that's typically put on the face before the wands are used. This superconductive gel provides a superhighway for the current flow and perfectly demonstrates how electricity travels the path of least resistance. The current passes from one electrode through the other, through the gel. It never passes into the skin. Repeat, it never passes into the skin. We've also seen techniques where dry Q-tips are used and a product has been applied to the skin. There's very little chance the current is getting under the skin. Instead, it's most likely traveling across the skin, following the path of least resistance. Again, Ohm's law. So it's time for a reality check. No matter how little product you have on the skin, to a subatomic particle trying to get to the other electrode, it's like a tadpole swimming in the ocean. It's time we talked about the material that you're applying to the client's skin. Stainless steel looks smooth to the naked eye, but under a microscope you can see all the grooves and imperfections. This is the perfect breeding ground for biofilm, a bacterial slime that can be transmitted between clients. This is known as cross-contamination. You can't just wipe this away, as the biofilm remains in the grooves. It must be thoroughly disinfected and sometimes autoclaved. Electrode gloves depend on a silver thread to conduct the electricity. Most manufacturers ask that a conductive gel or spray be used due to the high electrical resistance of the gloves, and that's Ohm's law. These gloves were designed for higher output TENS devices where you can increase the power to overcome the skin resistance. These gloves, due to their high resistance, are not well suited for microcurrent use, and you have a higher potential for biofilm growth than you do on the steel wands or probes. Instead of gloves, think about using our ion pump mask. This is essentially a full face electrode that's self-adhesive and has a built-in conductive gel. This duplicates all of the hand movements that you make with gloves or with a broad wand, but it's unattended and actually covers a larger area more efficiently. In some cases, you can convert your existing metal probes and wands to our universal multi-purpose Q-tip probe by using a pin-to-plug connector. In some cases, we can convert your unit to our probe. We've shown in this video that using metal probes or wands is an inefficient technique. that the current travels through the gel rather than down, across, and up through the skin. We've shown that using metal probes or wands is less sanitary than simply throwing away used Q-tips. And we've shown a better way to deliver the microcurrent by using disposable wet Q-tips and no other product on the skin.